Hello, good afternoon, maybe morning, whenever it is that you decided to open up and watch the video that has been sent to you. I'm Kim Holt. I'm a licensed professional counselor and I work at Family Services.
And I'm Christine Peterson. I'm currently an intern here at Family Services, and I'm getting my master's in counseling with a concentration in art therapy.
So we're really excited to have a few minutes to talk to you today. We'll try to keep it as concise as possible. And along with this video, you will get a list of resources as we share them on the screen. So we will, without further ado, I'm going to introduce the topic. Today, we decided to talk about anxiety. Basically what anxiety is, some of the signs and symptoms. And one of the reasons we chose this is there's some work that's being done in the schools with your children around this topic, coping skills, ways that you can help alleviate and help them regulate their emotions as you also work with your anxiety. Because of the pandemic, we thought this was really timely and important, as well as the upcoming holiday, which can add a lot of extra stress on families. So I'm going to turn it over to Christine to tell us a little bit about what anxiety is.
Sure, thanks. So the American Psychological Association defines anxiety as an emotion characterized by feelings of tension, worried thoughts, and physical changes like increased blood pressure. Some people report a tightness in their chest, muscle strain, breathing shallowness. People with anxiety disorders usually have recurring intrusive thoughts or concerns. That means thoughts that just keep popping into your mind. And we could probably all at some point in our lives qualify for an anxiety disorder because we do go through stressful situations in life. With anxiety disorders, we may avoid certain situations out of worry. And again, those physical symptoms may be present, such as sweating, trembling, dizziness, or rapid heartbeat.
So that some of this checking in, Christine, with what you said as you were talking, I was like checking in with myself physically, right? Mm-hmm. And recognizing, because we all might experience it somewhat different. So being able to check in with yourself in a situation and say, okay, my heart feels funny. It's not probably related to a heart attack, although it could feel uncomfortable.
That's right. And those are some of the symptoms and signs that you may notice first in yourself, are those physical sensations, and that can help us from it escalating further if we have some coping skills, if we know what to do, which is what our video is about today. Some other symptoms and signs, though, in others, in children, could be mentioning some of these worries, being preoccupied with these worries, even fast speech, avoiding stressors. That was one of the signs that we talked about. So for your child, that might look like maybe not wanting to go to school pretty consistently. What's going on? Are they having worrying thoughts? Can you think of any others, Kim?
Well, I was thinking that kids sometimes have a hard time articulating it, and we as adults want them to say, well, why? What's going on? And a lot of times kids can't. So I think being able to talk about those physical symptoms and having them tell us what's going on in their body, rather than just focusing on the why, is really important, because our job is to help guide them to understand their body and what's happening. So I think that that's probably one of the best places we can go. I mean, little people have a lot going on in their minds, and they just can't always get the words out.
Mm-hmm. Good point. Yes. And we've seen anxiety levels really increase in all individuals, but especially young people during the COVID-19 pandemic. In fact, there's studies coming out now. I just looked at one today from the National Institute of Health that was publishing it. And it was talking about a cross-sectional study with the younger age of a person and isolation being some of the biggest contributors to feeling stress and anxiety during this time. So you may have noticed more worry thoughts yourself as an adult, and with your children, it might be even more intensified for them. Mm-hmm. One of the things, though, that we wanted to talk about with anxiety is transference. this idea that we as humans are sensing each other's nervous systems. There is science to back that up. When someone is angry, we may also feel a little bit more angry around that person. So with anxiety and being around our children, we may inadvertently send some of those messages from just our physical state to our children about anxiety. We can influence the levels of anxiety that our family members experience.
That makes a lot of sense to me, because I know as the agency's director here, a lot of times I'm the complaint department. So people will come into my office, and if they're heightened and have a lot to say, I'll notice that sometimes my heart starts racing. I might have quick speech. My mind, all of a sudden, I can't clearly give them an answer because my emotions kind of take over. So that's that piece of that transference that I'm aware of. And I try to take some deep breaths and recognize that their anxiety is playing into me. And that's that transference piece. It's transferring on to somebody.
Mm-hmm. So we can be really aware of that in ourselves. And as adults, regulating our own anxiety symptoms, we're not necessarily going to get rid of all of the anxious thoughts. They're intrusive, right? So we can, though, lower the symptoms of them for our children so that their experience is lessened through our experience. And we're also modeling really good techniques and skills. So how do we actually manage anxiety symptoms? So we want to learn some good coping skills. And we will, like Kim said, provide you with a list of resources that help to teach about those coping skills or offer opportunities for you to practice those coping skills on your own and with your children. But coping skills are really just strategies. A toolbox, you might think of it as, pulling out the different tools that you need. And you might not always need the same tool in the same situation, right? If you have a nail, you're going to want a hammer for that. But you want a screwdriver for a screw. So we want a variety of coping skills. The more we can develop, the more prepared we'll be when symptoms of anxiety are occurring for us. So the first one I want to talk about was mindfulness. And grounding can be a part of that mindfulness. Mindfulness is the practice of staying present. A lot of times anxiety in thinking shows up as worries about the past. We're going over and over things in our mind that already happened, or they can be worries about what hasn't happened yet, but what could, the future. So mindfulness is really effective when we use our five senses. Our eyes, our ears, our sense of smell and taste, and our touch. So we know with children, fidget spinners were really popular for a while, and now it's those poppers, right? That's actually a great coping tool because it's keeping us in the present moment on the sounds and the textures and the vibrant colors of those things. And we can practice mindfulness even if we have nothing in our hands. We can look around the room, find an object without judging it. Just start to use our senses to explore that object. A lamp, for example, I'm looking at it with my eyes. I'm seeing that the base of it is metal. And it's brass, maybe, and it's shiny, or maybe there's some dust on it. I'm not judging it, but I'm just trying to see everything I can. And then I'm moving on to if it's making a sound, maybe there is a very soft buzzing coming from the light bulb. So you can just explore as many senses as possible. It's really difficult to think about worry thoughts when you're trying to explore something in your present world with your five senses.
I was going to add to that. One of the ways, and I've seen this happen and being a mom myself, is your child comes home from school, right? And your child is really worked up that their teacher wasn't fair to them. And they have all these complaints and worries. And all of a sudden you go back in your mind thinking about when you were in school and something that wasn't fair happened and that you had a really difficult time. So then the past is flooding and you're all of a sudden reacting, right, in such a heightened way. So staring at the lamp, being able to be present and not bring up that old stuff would really keep your emotions in check, which will help role model for your child.
Right. I think it's important to note for all of these coping skills we're going to talk about that we want to practice them when we're not feeling anxious. So
Okay.
that way we're already trained. You know, it's sort of like someone in the military, they get training before they're in active combat because
Yes.
they want that training to kick in. So these are discussions you can have with your kids. You can check out the resources. We'll show you some apps, some books, some websites.
Awesome.
Go visit them, please, before you feel that really heightened anxiety or feel attacked by that anxiety, so that you're already trained for them. The next coping skill I want to talk about is progressive muscle relaxation. And it is kind of like the name suggests, progressively you're going to move through tightening. I'm going to show you with my fist here, holding it and loosening it. But you're going to go maybe from your head to your toes or from your toes to your head. And I'll show you a site where you can actually get a script that will lead you through that progressive muscle relaxation with each muscle group. And that will really relax you physically. As we said, there's a big connection between anxiety and your physical body. So relaxing the muscles in your body are going to help relax your mind, your thoughts, your worries as well. Similar breathing strategies, you can do them anywhere. And they may not make you feel as awkward as doing progressive muscle relaxation in public, although there are ways to do some progressive muscle relaxation inconspicuously. But I like the 4-7-8 breathing method. There's lots of ways to help you be mindful and oxygenate your brain so you have clearer thoughts, right? You're more in control of your thoughts that way. So for the 4-7-8 breathing, I like to breathe in through your nose, and you count to 4. So breathing in through your nose, holding it for 7. And then breathing out through your mouth for 8. And I do that 4 times, that cycle.
I love that. I've never done that before.
It's so great. There's some science behind those numbers. Don't ask me how it works, but the science shows that it does bring a lot of oxygen to your brain. And when I can't sleep at night, maybe anxious thoughts are keeping me awake, it really helps me to be able to fall asleep.
Mm-hmm.
So that's a good one. Cognitive restructuring or reframing is a part of cognitive behavioral therapy. It's a really fancy way to say, when we change how we think about something, we often change how we feel about something, which changes how we behave. So by changing the way we think about something, we can lower those anxious thoughts. For example, saying something, I'm going to go with the pandemic as an example, saying something like, the pandemic will never be over. That word never, we can reframe that because it's probably not true.
Mm-hmm.
It might be that this virus sticks around for a while. It might be that we have to be more careful than we were before this time period. But to say never will be over, that's immediately telling your brain and your body to prepare for disaster. So we want to start to catch ourselves with words that are permanent. Never, always, and also replacing our shoulds with coulds.
Okay.
Really easy tips for reframing, right? Oh, I should go to the gym today. We can worry about that and have higher anxiety. Or we could say, I could go to the gym today, making it a choice where we are in control of what we choose to do. Anything else on those coping skills, Kim?
Well, I was muting myself because it was a little noisy on my end. So I was going, and you probably couldn't hear me. I think we've talked about this in some of the earlier work that we've done with the parents is how your thoughts are connected to your emotions. And so really stopping and thinking about the words that we're saying, because words are really important and they have a lot of connotation. So stopping ourselves from using those absolute words is also a good way to role model for our kids too. So
great point. And that goes so well with mindfulness, right? Being able to slow down enough in the present moment to choose the words that we're saying carefully.
and if you find yourself as a parent using those words, always, never, everyone, I always say as teenagers, my example is, well, everyone gets to stay out late. Everyone's curfew is past my curfew, right? If you find yourself as a parent using something like that, stop and reframe it and do that work with your child. You know what? That's not really true. I don't know why I use the word never. And that is really helpful, for us to correct our thoughts and they hear it.
That's great. Yes. Modeling helps you be accountable and also teaches your family how to join with you in treating your anxiety, really.
Mm-hmm.
Okay, so I would like to share some resources now. I'm going to share the screen here.
I'm really excited because with me being a little bit older and it's been many years since I've been in school, I'm so used to like telling people, here's a book you can order to put that book in your hands. And one of the things that when Christine was preparing for this video was the fact that there's so many apps and so much that you can get just readily at your fingertips that when I was a parent wasn't as readily available. So I'm excited about this piece.
I'm excited to share it too. I like finding new resources. Okay, hopefully you can see that. So this is the publishing page for a book that I recommend. It's called What to Do When You Worry Too Much. It's based in cognitive behavioral therapy. So it actually helps you learn and teach the skills that cognitive behavioral therapy, CBT for short, would use in treating anxiety. It is designed to guide 6 through 12-year-olds, although I think that your children much older could benefit from this as well, because it is designed to be read with the parent. So the level isn't dumbed down, but they use the metaphor of a tomato plant through the book to help talk about anxiety and how it grows. So I really recommend this book. The next site, oh, go ahead, you're muted.
Of course, there I am. I love using metaphors because a lot of times with kids, that illustration that you showed, and once we learn it and feel more comfortable, because it sounds sort of fancy, but once we learn it and we're in a better place with it, that metaphor is so easy. And you can continue after you've used the book to talk with them about the metaphor that was outlined there. Exactly.
Great point. The next website, I'm just going to show it to you briefly. It's called infoaboutkids.org, and a variety of organizations focused on mental health and physical health got together to provide resources for families about a variety of topics. So while it's not focused specifically on anxiety, you can find information on anxiety and other topics for your family here. And it is science-based. So if that is important to you, then this is a great website for you. So here it is. It's called infoaboutkids.org. And you can see that you can click on each of these categories: relationships, emotions, body, and it talks about healthy development, or you can scroll down to read just short paragraphs describing these topics. Another website that I think is worth it is called Therapist Aid. Now, this is actually what we use a lot with clients, but there's some interactive games on here. So it's all free. And right now I have the anxiety topic pulled up, and I'm going to show you how to get to a game for kids called Worry Bugs, where they get to interact and click on bugs, try to catch them, just like they might their anxious thoughts.
No, I was just thinking, it's funny as we're sharing our smiles and we're laughing a little bit, doesn't that just decrease your anxiety too? You know, being able to work with someone else. So if you have a parent or friend that has kids the same age, it's nice, right? To know that what you're feeling and experiencing is somewhat normative. And sitting with someone and laughing and just trying to find a little bit of humor in your day can be a relaxing intervention.
Excellent point. It doesn't have to be complicated. It can
Yeah.
be as simple as having our faces and our body language reflect where we're trying to get our family to be emotionally. So leaves on a stream, the idea is, again, a metaphor, this picture of leaves floating down a stream. And this worksheet begins to help you see the thoughts, the worry thoughts, the anxious thoughts coming in your mind as leaves floating down a stream, where you really see what's there and you decide which leaves to pull out of that stream and which to let flow by. I think that's really helpful. Up here at the top is interactive tools, and we have a leaves on a stream. So you can actually practice catching those leaves. There's a grounding exercise. We talked about mindfulness, and I mentioned grounding along with that. And then here's the worry bug. So it does give you the age appropriate level you can choose for the developmental age of your child. And there's even a progressive muscle relaxation audio that your kids can enjoy. So I highly recommend therapistaid.com. I have one more website I want to show that has a list of apps. I could have found all of these separately, but I found a website that had done a really beautiful job of collecting them. So I'm going to share that with you. We normally encourage people to turn off their screens, but the reality is sometimes we have our screen time and we can make good use of it. So not all screen time is bad time. We can introduce our children to apps that teach mindfulness, grounding, that play music to help calm anxiety. And I just think this is the best of technology.
You know, I was going to say too, the important piece sometimes is not so much that you're saying something correctly or you understand an intervention, but if you're creating a safe place, emotional safe place for your child to just sit with you and decompress and be able to vent, and you can validate how hard things are and that you understand them. Sometimes it's not always about problem solving for them. It's about being heard.
Absolutely. I'm just going to scroll down, but I'll include these on your resources so you'll have these apps. There's one that Sesame Street came out with, Calm. I've used this one before. And so they have things for kids and adults both on there. Some of these are free, some of them are not. So you can look as you search for them, which ones are free and which ones are not. Dreamy Kid, Headspace is a pretty popular one. There's also something called the Kids Yoga Deck. So if you enjoy yoga or have been wanting to get into it, this will give you a pose to do. This is creating that mind-body connection. So we're more aware of when anxiety is coming through our physical symptoms first, then we'll have a better opportunity to regulate and lower the anxiety. Stop, Breathe, and Think. I've used this one as well. Breathing bubbles. I haven't used this one, but I would really like to.
Yeah,
The idea of a bubble is already calming when I think about that. Smiling Mind, Positive Penguins, Calm Counter, Emotionary. So this is all about identifying emotions so that we can start to build our vocabulary and your children can begin to articulate, I feel anxious, I feel worried, and be a little bit more direct and accurate so they can communicate effectively with your family. Take a Chill, Chill Outs, another yoga app here, Super Stretch Yoga, and Relax Melodies, which is that music one I told you about. Well, hopefully these have been helpful for you.
I just wanted to ask one question, Christine, because you went over so much information, but I know you mentioned developmental age. Could you explain that a little bit? So when you see like 4 to 10, helping people understand what developmental age is.
Sure, it could be your child's chronological age. Like if they're 4 years old, 7 years old, 10 years old. But sometimes people are not matching with their chronological age. Could be a developmental delay, it could be even trauma that you're dealing with. So some of you may have children who are 8 years old, but developmentally, they may be functioning emotionally or cognitively more like a 6-year-old or a 4-year-old. So that's what I meant by developmental age. You'll just, you know, your children, so what is appropriate for them, you can find. Basically, don't be ruled by the age appropriate level. Just find what works.
I love that. Oh, I agree. And I've noticed even with my children that are now grown, sometimes they're comfortable and it takes them back, right? So watching something, we said Sesame Street, so your child might be 8 years old. They might find comfort in that. That could be kind of fun to reminisce. So I agree. Don't be scared off by the ages. Well, thank you, Christine. This has been so helpful. I know I didn't add as much, but I learned a lot today. And I'm really hoping that as we put this in the hands of our parents here in Warren County, that you as well find some of this useful. Remember, if you do or are in need of any services, Family Services of Warren County does provide outpatient mental health therapy, helping with parenting, goal setting, anxiety, depression. We also do drug and alcohol counseling. If we can't answer a question, there's something that you need, chances are we can make a referral to the appropriate place. So if you have any needs, we'd love to help you guys out. We wish you a very happy holiday season. For some of you, it's just another day. It just might be something that's another day on the calendar, and we hope for good weather and for the health and safety of all of you. And we will see you again next year, which is 2022. So, all right, we're signing off. Goodbye, everybody.
Bye.
Bye-bye.